So welcome everybody to our monthly Community Mental Health Transformation webinar. I'm Megan G, the Communications Manager for the programme, and I am joined today by my colleagues within the programme team who will introduce themselves shortly. And today we're doing a special webinar as it's going to be more of a panel discussion to give all of you the opportunity to ask any questions that you have about the programme directly to the team who are working on the programme. So it hopefully will be a really informative session for you all today. So do get thinking about any questions that you would like to put to the team. But whilst you're thinking about that, I'm just going to run through some very quick housekeeping. So if anyone would like to turn on live captions for the session today, you can do so by clicking on the three dots that should be showing up at the bottom of your screen, and then you can turn on live captions for the duration of the session today, which will hopefully be helpful for you. There is usually just 15 minutes for Q&A at the end, but obviously we are focusing solely on questions and answers today, so that isn't as relevant. Because this is a live webinar, we do encourage you to obviously participate and feel free to obviously have your cameras on and to use the hands up function. But just a note to say that this webinar is recorded so that colleagues and members of the public who would like to watch but aren't able to tune in live can still watch it back later. So because it is recorded, if you would prefer to not have your camera on, that's absolutely fine. There isn't any pressure for anyone to do so. The recording will be added to our community transformation playlist, and on there you can watch back all of the previous ones that we've been doing since November of last year. So there's quite a selection to work through if you haven't watched them before, or if you would like to watch them again. We'll send round some notes after the session today, which will also include a very short survey, which we'd really appreciate if you're able to complete, as it just helps us to make sure that the webinars continue to be useful for the people who are tuning in. And it also gives you the opportunity to put forward any suggestions that you have for topics that you would like for us to cover. As I said, all previous webinars can be watched back. You can scan the QR codes on your screen if you want to have that ready for you once you finish watching this one, but also it will be included in the notes that I'll email around to you later on. And lastly, if you haven't already, do sign up to our monthly newsletter, as well as the webinars. The newsletter is a really good way just to stay up to date with all the latest progress that's being made, and it also promotes the various opportunities that we've got across the programme for you to be able to get involved, to share your ideas, and to be really involved and part of the work. So do sign up to that newsletter if you haven't already. So now we're going to get straight into it. So what we're going to do is I'm going to invite the team to introduce themselves individually. So if you can introduce yourself and your role, and if you can start off by telling us all what your highlight would be of the past 12 months within the programme so far. And I'm going to start off with Penny, if you'd like to go first.
Certainly. Thank you, Megan. Good afternoon, everyone. My name's Penny Fenton, and I'm a mental health nurse by background. I'm employed by Sussex Partnership, but I work across the whole system on community transformation, and have been involved in the programme pretty much since the beginning. So that's been really exciting. And the best thing for me over the last 12 months is our real move towards co-producing and building partnerships and recognising ourselves as a system. And I've really started to notice how we're moving away from making independent decisions and working in silos and coming together to make the best use of our resources, both for people who use our services and our staff. Thank you.
Thank you, Penny. And Emma, would you like to go next?
Afternoon all. My name is Emma Logie. I'm one of the senior managers at BHT Sussex, but that's only half of my role. The other half is to represent West Sussex VCSE as part of the transformation. I share that role with Leanne Challen and Karen Page at West Sussex Mind also. I would say one of the biggest highlights in the past 12 months was our Crawley pilot workshop, and just hearing from lots and lots of people who've experienced, lots of carers and families, and how we've tried to sort of keep that conversation going. I think that was a real highlight for me.
Thank you, Emma. And I think there are lots of people on the call who were at that workshop. I was, and I would agree that that was a real highlight. So thank you for reminding us of that day. Andrea, would you like to go next?
Sorry, just unmuting myself. Hi everyone, my name is Andrea Potter and I'm the VCSE mental health lead, and I cover, so similar to Emma, but I cover Brighton and Hove and East Sussex, and I'm also in charge of running the VCSE mental health networks. That's an opportunity to bring voluntary organisations that work within mental health together, and to have a voice within the transformation. And I think my biggest highlight over the last 12 months would be around the consultation of the new model. So the model diagram that's been developed has been really, really interesting to take that out, and particularly to take it out to the network and get feedback on the diagram, and make sure that the voluntary sector has a chance to influence and be involved in that design process. Thank you.
Thank you, Andrea. And Martin.
Thanks, Megan. Thanks for not leaving me to last as well. So Oliver's got a tougher job as well to think of new ideas. But yes, hello everybody. I'm really pleased to be here. So Martin Donnelly, VCSE Transformation Lead for East Sussex and Brighton, working within the kind of services as well. I've probably got quite a few, Megan, actually, but I'll try and limit them. I'm just thinking around kind of what we're trying to actually resolve and what we're actually trying to improve. And obviously we kind of have at the current sort of moment a very disjointed sort of mental health system on services in different places, requiring people to do, require people to have different eligibility to get in different services as well. So I think that move to that kind of concept of one system and one team supporting people, I think is a really important step forward as well. Really kind of pleased to sort of see a much more kind of localized offer being developed across the whole of Sussex as well, and bringing support closer to home to people. And I think that's another really important principle that we've really stuck to as well. And then real practical change. Often we can talk about things in concepts and kind of think about how we'd like things to work, but there are some real practical changes that are starting to ring through the programme as well. And I know we're going to be going into a new phase kind of currently as well, which will be aligning services and actually really making a difference to how people experience that service as well. And I think just from a sort of a team's point of view, I think there's been real good resilience as well. I think when we started off with this service that, there's a promise of more money as well. And I think even though we've had some real disappointments and some setbacks and some challenges, I think as a kind of a team really trying to kind of push this and really develop this offer, I think we've been really resilient and a really good partnership as well. So it's quite a few there, I know, as well. So just making Oliver's job even harder. Sorry, Oliver.
Thank you, Martin. I think all very relevant points. So don't worry, it didn't have to exclusively just be one. So thank you for sharing those with us. And last but not least, Oliver.
Thank you. And fortunately, Martin didn't take my my one, but so I can still use that. But so I'm Oliver Dale. I'm a consultant psychiatrist by background, and I'm the clinical director for the Adult Community Transformation Programme. It's a bit of a funny question for me because I only started in May, so it's all been really new, and I've met so many people and had so many conversations about all the work that's going on, so it's quite difficult to pick. But I suppose the one that sprung to mind was we held a workshop on a couple of weeks ago in Worthing. And it was the first time for a while that we've been able to bring all colleagues from SPFT together, along with representatives from VCSE and primary care, and lived experience representatives. And what was really exciting for me was that the team were able to present where we've got to so far, all the work that's happened, and the partnership through which we've achieved all that, and where we want to see things develop, and in particular in terms of creating services which are much more relevant to our local communities, much more integrated, and able to make use of the assets and resources that each community has, but at the same time providing longitudinal care thoughtful care for people when they need it. And so what was exciting was for us all to arrive at a shared vision of that. So I think that's the biggest challenge is if we all agree where we want to get to, then it makes all the very difficult decisions and challenges ahead all that more easier to address, because we've got our combined creativity and investment in that destination, which makes these things much more solvable. And picking up Martin's point about the money, there's never enough money. We could always do with more resources, but I think in particular there was a disappointment here, and I think the financial situation of the country has just made that a bit worse, really. But the fact that we know where we want to get to is such an important step, I think. So that was for me a big highlight. Actually, I left that day feeling, yeah, we're on course here.
Thank you, Oliver, and thank you all. And I think I'm going to throw in my highlight as well. So I've already introduced myself, you know who I am, but I think for me, as somebody, I'm employed by Sussex Partnership Trust and have been seconded into this programme of work. And I think the highlight for me is that I'm really enjoying getting to work much more closely with colleagues within the voluntary sector, experts by experience, families and carers. I'm getting to do that in a way that I haven't been able to do that before, working solely within the trust. And I'm getting to learn so much from our colleagues. And I'm just really, really grateful for the opportunity to work in this way, and sharing this approach with my colleagues within the communications team to say that this is the way that we need to be working, and that it can't just be exclusive to this programme, but this is the way that we should be working moving forward. So I'm incredibly grateful, and I'm enjoying this experience so much for that. So I think that would be a big highlight for me. So thank you all for introducing yourself. I'm so pleased to see so many people have joined us today. And this is obviously an opportunity for all of you to be able to ask those burning questions that you've got about the programme. It can be about specifics, it can be about more general things, but yeah, no question is kind of off limits today. So you know, you've got a couple of options. You can either put it in the Q&A box if you'd rather I read them out, or feel free to raise your hand and we'll come to you. But don't be shy. Feel free to ask any questions that you have. And if people do need a little bit longer to warm up, I can continue to ask some questions of the group. Mel, thank you.
There's just one thing that we have heard slightly more than 3 or 4 times over the last month or so. So going back many years, is there a way where we can talk to the patient without calling them a patient or service user or customer or client, and just call them by name? Because more and more of my constituents get more and more upset because different people are comfortable with different ways. And so if we just call them by name instead, that would be a marvellous achievement. It would make them feel much more accepted.
Absolutely, Mel. And I think that ties in really nicely with the work that myself and Jonathan Beda, Natasha Bearfield and colleagues on the call today have been working on around the language that we use within the system.
Acronyms,
health,
for example,
absolutely.
if we on our webpage could have an acronym buster, because it means different things in different kinds of medicine, and then also to send that link to that page to general practitioners, because some of them also get confused by the acronyms because they've only got 4 different acronyms for 6 people. What? It can very much swamp people. And one line I've had, and then I will shut up, but this is a brilliant line. A service user turned around to me, she said, I just wish that my letters came in English, in normal English, so people spoke to me in normal English. And she was actually thoroughly supported by staff as well. It wasn't an emotional woman moment, which I can hold my hand up to. Yeah, I don't understand my acronyms either, but it was admirable, actually. Nice way to put it.
Yeah, absolutely. The importance of making sure that any communication, letters, everything is accessible to all, that we are just using plain, simple language, not overcomplicating things. And that is something that we are looking at within the language work. That there are also a couple of other projects that are happening. There's a project specifically within Sussex Partnership where they're looking at some patient letters at the moment, and we've brought that project into, yes, so we've brought that project into the language work, so we can make sure that there is an alignment between the work that's happening. And that's also we've also brought in our colleagues from Changing Futures, who are supporting the trauma-informed care work, to ensure that everything is aligned, and that essentially what we end up with is a consistent language that is easy to understand and accessible for all, to ensure that people are able to seek the information and support they need when they need it. So yes, absolutely couldn't agree more, Mel. I'm not sure who came in first. Oliver, were you first with your hand? Zoom doesn't tell me who was first, unfortunately.
So I was second, but Martin lowered his hands. I wonder if you picked up one of his points.
Yeah, Megan, I think you've kind of covered is some of those work, isn't it, around the change the language and that work. But it's also around the kind of the comms group as well. There's a separate comms group about where information's held, and that will be kind of make sure that that's a kind of an easy and appropriate kind of place to actually go and receive information or look up information without these acronyms as well. But I think you were covering it. That's why I took my hand down, Megan.
Thanks, Martin. Oliver, did you want to come in?
So I think, Mel, you're touching on something that is a sort of a part of a conversation that is happening nationally. There is a way in which the services have sort of lost sight of the importance of relationships, with one another, and in particular collegiate relationships with colleagues, but also trying to maintain continuity of care with patients and carers. One of the things that I struggle with is if a team ever gets back to me, even when I'm in a patient or a colleague role, and the responses from the team or the ex-team, I find that quite difficult. I'd much rather have a name.
It is quite uncomfortable.
Yeah, it's very.
You think, no, I'm still putting in.
Yeah, it's a bit. It can feel dehumanizing and depersonalizing. And so some of the plans that we have in mind, whilst they might be quite sort of concrete and simple in some ways, the culture and the concepts behind them are around trying to support the working relationships between colleagues, but also maintain continuity of care for the people that make use of our services.
The people who make use of our services, and sorry for making this conversation, but it's a really good point, are actually, since COVID, are so much part of the team now. They don't feel like they're being treated. They feel like part of the team, and they really are wanting to help also. And staff have been brilliant, and actually then turning and using EBE, and it's been of benefit and value to everyone.
Absolutely, and so the co-delivery of services is a really important part of the overall plan. And whilst a lot of services have got lived experience practitioners working in them, we haven't quite got that across the piece yet, and so there's a bit more work to do, frankly.
It's aware and it's being looked at. It's not just being sitting there going, all right. It's not the way it is with you guys.
Thank you, Mel. Okay, so if anyone has any questions, this is your moment. Do pop your hand up, put it in the chat. I know it can sometimes feel a little bit daunting, but we are all here and obviously just want to be helpful. So, you know, if you do have any questions at all, no matter how big or how small it may seem, you know, do please feel free to use this opportunity, just to kind of keep us thinking about things. I'm going to pop a question to the team, if that's okay. So obviously within this work, there's been a real emphasis on the importance of co-production with people with lived experience of mental health difficulties, carers, people working across the system, different organisations, different roles, different backgrounds. And are we able to capture kind of, if one of us wants to jump in and say kind of what have we done to really involve people in a meaningful way within this work, and how are we continuing to do that? I don't know which one of us would like to jump in.
I'm happy to if people want to jump in with me.
Thanks, Penny.
I think over the last 3 years, it's something we've really stuck to. So I think back to the beginning, what we've tried to do is have some big workshops with lots of people, very purposefully not asking people about their roles, but just about their interest in mental health when they've come to those things. So whether people have, as you say, experience of using services or working in services. And we've also, I think all of us together in this team work really hard to be equal in our partnerships. So to really utilise, so Andrea and Martin, I'm sure will have something to add, and Emma, all of those skill sets that those 3 BCSE areas have had in terms of really building things up, and all the expertise as well about their links to experts by experience. And I know Emma in particular has a real drive and passion, is always keeping that on track alongside other colleagues, for example. So it's really about it's been about us not thinking as Sussex Partnership, but been us thinking about as a group of people across the system, how can we really get to as many voices as we possibly can, and being really clear about co-production and making sure we do have that voice. And where we don't, because it hasn't always been easy in different parts and different meetings for lots of different reasons, we've kept flagging that up as a risk and an issue and continually trying to find ways around it. Colleagues on the call have held numerous events across voluntary sectors, across places. A recent one that I'm sure Andrea and Martin will talk about with carers, and all of those things continue to happen. So for us, at every single point, we're thinking about how do we get this out? How do we have the discussion? And yourself, Megan, have obviously been instrumental in gathering that feedback together and help us keep having new iterations of the way that we might work. And I think we're finally at a point over those 3 years to be able to describe all of that input in the model that we've kind of arrived at today, the next place we want to go, so to speak. But it's only the start of the journey, so we'll need to continue to do that. It will remain absolutely critical on our agenda. It's something we talk about with NHS England as well. And in Sussex, we're unusual in that we've got this real breadth and strength, particularly with the voluntary sector, which hasn't happened in a lot of areas across the country. So I think it's the commitment of the team to be absolutely committed to the principle of co-production and to talk the talk and not just walk the walk. So even when that's difficult, it still happens. And it has been difficult at times. We've had to have some tricky conversations. So, and any ideas from this group and any bits we're missing, we're always really keen to hear about that, particularly those voices we don't usually hear.
Thank you, Penny. Martin, did you want to add anything?
No, just to agree with Penny really about the kind of the effort that we put into actually kind of make sure that we do involve people around some of the figures. I know you've probably got them more to hand around consultation that we've done around the model in terms of actually not making sure that we actually don't take out finished products, that we actually take out and discuss and consult and take feedbacks of direction of travel, because that's when people can really meaningfully kind of influence things and really kind of meaningfully input on things, and we can go away and make those changes as well. But I really like kind of Penny's last point around kind of our future challenges really, and I think it is thinking about how do we get lived experience or participation at every level, and some of it sits above us in terms of a program team, but how does it sit at the kind of new integrated care boards as well? What are the standards that we kind of really trying to achieve as well, and how do we build that kind of approach in everything that we do? And to do that, we need to we do need to fund things, structure things properly as well. And you know, we kind of make sure that it's actually formalized as well. And I think that's really kind of important. But then what we do, you know, and I think it's very genuine, as Penny was saying, that when we do get feedback, we do get comments, we do get that kind of, you know, challenge and criticism at times as well. We do really respond to it, and we do make changes at the back of it. And again, Penny's kind of really raised to some of the, I think, something that we've really identified more recently about challenging ourselves around family, friends and carers, kind of what's our response, how do we include them more as well. And I think that's going to be a kind of a really kind of good bit of work that we can sort of take forward in our next phase as well. But yeah, thank you.
Thanks, Martin. Oliver, did you want to come in?
Yeah, so it's really important also that we're quite specific about what we mean by co-production. So there's the co-production of working with partners, which I think we should be very proud of here. I think there's co-production in terms of involving people with lived experience in the development of the model and the plans. And again, I think that's something we should be proud of. There's still some gaps though, and I think the central team are thinking about how can we make sure that we feel completely confident that is throughout the system and the different structure. There's also the co-production though of lived experience practitioners working in our services, doing assessments, interventions, contributing to the formulation and things like that. And again, I think SPFT has a lot to be proud of, but there's more to do. And I'm hoping we have peer support workers across the team in every single service that we are developing. Again, I know there's a lot of good practice, but there's a lot more to do. But it's certainly when I've worked in a team, I think having the peer support role, having peer support workers in the team is such a huge opportunity in terms of engaging people and working alongside them in a way which says one of my colleagues, lived experience colleagues, calls it in creating an affinity space where we feel we can connect right from the word go. That's a really important part of working with people, particularly if they've been traumatized.
Thank you, Oliver. And within the chat, Deb very helpfully suggested it would be good for us to co-produce some sort of measure around involvement for localised services. So Deb, thank you very much for offering to talk to me about that. We'll get in touch with you because I wanted to actually flag that there are a number of colleagues on the call now who are really helping us within this programme to make sure that we continue to kind of check ourselves, really, that we are co-producing and doing this work in a meaningful and truly co-produced way. And Deb, also you are one of those people, so I will get in touch with you because I think that would be a really, really useful piece of work for us to do. Penny, did you want to come in?
Just briefly to say, one of the things we're really keen on formalising more as we progress is those agreed standards, both for co-production in terms of developing the services and delivering services at a local level and evaluating them, but also at that peer level, you know, what are the standards we should expect within every team, which is the stuff I know that you're really involved in and helping with, Deb. So we do, when we start to talk to people about the development of neighbourhood teams, it will be an expected core component with its own really clear set of ambitions around what that might look like that we can agree with local teams so it doesn't get missed. And I think us doing that within our team has really helped when we go, okay, so it's the first thing people say in anything I go to now, which is a difference from 3 years ago, even 2 years ago, where people go, okay, how are we getting the voice? Where are we getting the expert voice in this? And things don't progress till that happens. And that's really, really critical. And I think we do need to continue to capture that. So that'd be great to carry on working with people like yourself, Deb, and others about making sure we've got it in terms of as we move to implementation.
Absolutely. Thank you, Penny. Philip, have you got a question?
I do, yes. Hi, everyone. I'm Philip Singh. I'm Head of Psychology at Crystal Pathways. We're currently running a pilot in Crawley for individuals who have secondary and primary care mental health needs and who are at risk of homelessness, which is funded by Department of Work and Pensions. So my question is, what are the plans to kind of jointly cooperate with other government departments on this? because I'm aware there's so much of good work happening across, but we only just managed to connect with you guys, and we will have some good findings from the pilot and we'd love to share it with everyone. But I think there's a big disjoint in between government departments and how they work together while we are working towards the same objective. So what could we do to make it more efficient?
Thank you, Philip. That's a brilliant question. Would one of our VCSE colleagues like to come in?
I'll go.
Thanks,
I
Emma.
didn't know where the hand was in this. Not used to this one. I think, obviously speaking for West Sussex, one of the things that we have are local planning groups. That I think there's 10 across West Sussex, and this stems from the Pathfinder work. But within those local planning groups, we regularly involve government bodies to come and sort of be a part of that. Just, you know, understanding the importance there. Mel, do you want to
unmute? Yeah, no, that has had such a good effect when you've done that. And even if people have had differing thoughts to the slightly upmarket person who's come along, they have really appreciated the fact that they've been spoken to, that this has actually been come and said to them. And there have been a couple of occasions when one particular person laughed like crazy as the lady said, "Do you mind answering this? Because I know we're recording." And it's been very good because it opens people up completely, so they can actually totally relax, but they feel fully tended to, and not just by someone who they see on Wednesdays at 3:30, by someone who popped in to go, "Yeah, I want to hear you." And that's no matter who it is, actually.
And there was
very
an
big effect
where someone brought something up recently as well, and the person was like, "Oh, can we take it outside of this meeting?" And someone said, "Well, actually, no. Could we keep it here and discuss it openly so we can sort of think about ways to support each other through this challenge rather than it being something separate?" And I just wondered, Philip, if you have any links to that LPG and are on the mailing list, and if not, would you like to be invited?
We would love to, yes. We found it quite challenging being a small company organisation to get in touch with you guys and find our way in. So hopefully that's the first step we've taken now. But yeah, it would be great to join for sure.
Sure. If you could put your email address in the chat, that would be really helpful. Thank you.
Thanks, Emma. Oliver, do you want to come in?
Yeah, I mean, it's such a good question that we could go on the whole day about it, frankly. But I think you're quite right, Philip. At the heart of one of the drivers for this program is around integration and working across different agencies. So in a way, the panel is an example of that. Although we're talking VCSE, there's something about the way in which we're also working with GP colleagues and our colleagues in commissioning and so on in a different sort of way. Penny might be able to say more, but an awful lot of work has gone into incorporating housing officers into our services, for instance. There's still more to roll out there, but that's been really positively received. The other thing is that the integrated care system is looking at developing things called integrated community teams. And again, these are sort of hubs where we've got multiple agencies working together. And I think Crawley's a bit of a leader in this area, actually. So I think watch this space, basically, and hopefully you'll see it developing more and more.
Thanks, Oliver. And I think what I would say to Philip and other colleagues on the call is that thank you for joining today, because it just helps with that networking, that connecting, and you know, so that we can start having these conversations and identify where those gaps are and where we can link up and work much more together as a shared system rather than in the silos that I think we have done historically. So thank you for raising that, as I'm sure it would have been of relevance to a lot of people on the call today. We've got just shy of 10 minutes left. So if anyone does have any more burning questions, please do feel free to ask them either by raising your hand or popping them in the Q&A box. A couple of people have had to leave the call, has had other meetings and things at 12:30, which is fine. Mel, would you like to come in?
it's actually a very positive note. I thought leave you with a good vibe as well. Though this is all very good vibes, is the communication between physical health and mental health has noticeably bettered. I have not met one person who's disagreed with that. And actually, reaching out to the GPs and giving them this information directly, things like Pathfinder, they actually need official introduction to it, and it's helped them enormously as a result. So it's just of note that, yeah, it is working. It's a lot better than it was.
Thank you, Mel. That's really nice for you to say. And yeah, and Emma, yes, we've got a celebration emoji. Yes, absolutely. And obviously it isn't going to happen overnight, that, you know, things feeling more connected, but it is happening. We're starting to notice it and feel it.
They're really, really
having an
noticing it.
effect.
Yeah, it's having a very big effect. Families who I've known for slightly more than 3 or 4 years, in the last year have just gone, oh yeah. And it's so, you know, we should say, yes, this is all actually working as well. We've got to look at the good stuff. I keep saying that, but we do. Come on, we're having a hard time.
Absolutely. I think that's really, really good that you've shared that today, because yeah, it's acknowledging achievements whilst also still being obviously realistic and mindful of the things that are still to achieve. Martin, would you like to come in?
Yeah, I think it's just that point around kind of how we're trying to bring physical and mental health together as well. And we know it is complex, and then we know that we've, you know, got some real challenges there as well. But I think what Mel's sort of referring to is what she's seen those improvements we are going to be building on as well. So we know that we've got mental health workers now sitting kind of PCNs or the GP surgeries as well. So there's a joined up conversation there. And our next phase is very much about bringing what traditionally we've called kind of primary and secondary, but we need to kind of probably move away from some of those labels really. But that whole joint kind of program that works much more fluidly together for people as well. And there's also some other initiatives that are going on. There's real recognition of if somebody's got a physical health problem, you know, if it's cancer or kind of going through some kind of, you know, some complex physical kind of long-term health condition, actually, there is a real mental health element as well. So I know there's some conversations that Penny and Oliver are going to be having with some other parts of the system and how we kind of work together and how we think about our neighbourhood teams also being able to support people's, you know, physical health and their mental health at the same time. So people don't necessarily have to keep going to different places. You know, they can arrange to meet somebody in somewhere that's actually much more suitable for them and that kind of meets some of their physical challenges as well, but also can receive that kind of dual support at the same time as well. And again, thinking widely, it's around kind of dual diagnosis of people that might be kind of using substances and mental health. Sometimes they can fall through a gap, and those conversations are also kind of starting to happen as well. So we are kind of constantly thinking about how can we align, how can we integrate, how can we work much closely together. But we are finding the people in the physical health settings really kind of up for that conversation as well. So it's really encouraging. So thanks for your question, Mel.
Thanks, Martin. Penny, did you want to add anything there?
I just wanted to go back to that partnership really, because that's really been at the heart of it. So Philip, it's great that you're here. And I just wanted to reiterate, anybody on the call in any bit of the system you don't feel you're connected with, please let us know. And again, if you're out and you hear about colleagues and partners that places we might have missed or new initiatives that might pop up, this iterative process of really understanding neighbourhoods. And I think once we get to identifying neighbourhood teams, so areas that will be really coming together to work specifically, this will be another bit of comms work to endlessly try and bring people in and really understand all of the community assets that we've got in a place that will really help a local area. So please do spread the word and get in touch with us if there are bits where we're a bit weaker or you can't see a presence or there's a burning question at any time, both obviously through the webinars but also outside of the webinars as well. So again, just want to reiterate, thanks for coming today, Philip, and please do spread the word across the whole system as with everybody else, so we can try and continue to build and grow. Thank you.
Thanks, Penny. Oliver, did you want to add anything there?
Yeah, just a quick one. It was because having worked in a similar model elsewhere, one of the things that struck me was the role of social prescribers or community connectors, and how they were really good at making these connections on the ground And so some of the people that I looked after, I can remember the special prescriber effectively working with a wetland centre, and they developed a bespoke course for some of our patients, and things like that were really quite exciting. And because they are sort of afraid of using jargon, but they're emergent, really. You don't quite know when you get the structure of this model up and running. You don't really know where it's going to take you, and it becomes much more live and relevant and local, basically. So I think, yeah, it's as Penny says, do get in touch.
Thanks, Oliver. And Andrea, would you like to come in?
Yeah, I just wanted to sort of highlight another recent example of that as well, that when we recently held our consultation session with carers last week, they highlighted making sure that there's a really strong link with the police, with the prison teams, with the justice teams as well, around people as they might move in and out of those services, and something that, yeah, so we're, as the team mentioned, we're always looking for that constant dialogue and feedback channels to be open so we can consider what else might be needed. And as again, also previously said, we want to kind of look where we can reduce duplication and work much more effectively and together in a joined up way. So yeah, I just wanted to highlight that. Thank you.
Thank you, Andrea. Yeah, absolutely. You know, just because, you know, we might have certain organisations in the room already doesn't mean that like the door is closed. We want to continue to welcome more people, so that we can connect all of this work together. Penny.
Just I know we're going to finish shortly, but just to add that in spirit of those pieces of work, also internally in the context of other bits of community transformation that are happening, just to let people know we're really linking in together as a whole transformation system, so we don't end up making the same mistakes. So there's a lot of work happening in urgent care, for example, as well as community transformation, as well as older people's mental health. And we're just really now at that point of getting better and working it through and pulling all of those things into one space, so we don't make the errors that we've potentially made in the past. Just for people to know that really and be aware. So anything around transformation we can pull in to the right people or lead people to the right space, but that we internally are also speaking together.
That has been really, really noticeable. People are now putting ideas forward and they're actually getting heard, and it's had such a good reaction. And when I say people, I mean anyone involved in, be that as well as the patient and the family, but actually be that staff, directors or governors, either way, everyone's putting forth, because they see it's not about their job role or their involvement level, it's about what's going on and how people feel wanted and needed and actually heard, and it's having such a good effect. Sorry, I'm terribly positive today. I'll shut up.
No, we love that. Thank you. No, I think that's actually a really perfect kind of final thought for our webinar today. So thank you, Mel. So we are at 12:45. That time has absolutely flown by. So thank you so much to everyone who's joined us today. And if you asked a question or if you have just been listening today, it's been so valued. So thank you. Our next webinar will be on Wednesday, the 15th of November. So I'll send around all the details of that within the email that will have the link to the recording today, as well as the survey. If once this webinar ends, you think, oh my goodness, I should have asked that question, it isn't too late. Just respond to the email that you get through. So it's the Community Transformation at SPFT email address. It'll come through to us and we'll make sure that you get a response. So yeah, the opportunity is still there if you do have any further questions. But yes, so thank you very much for the programme team joining us today. And yes, I hope you've all found it informative, and do join us next time. Thank you so much.
Thank you very much.
Thanks, Megan.
Bye, everyone.
Bye-bye.
Thank you.
Bye.